I'm now joined in the studio by Ceryl Nitz, Assistant Professor and Nursing and Allied Health Laboratory Manager, and student Sara Turnbull. Welcome to the show.
Nice to be here.
Ceryl, I understand the college has been doing simulation for more than 20 years. What is the benefit to students?
Simulation provides hands-on experience with patient care scenarios. Students have the ability to apply knowledge from theory and skills lab to different patients' situations. Simulation provides opportunities for students to practice critical thinking, problem solving, prioritizing patient care, therapeutic communication with the patient, the family members, the significant others, and students have the opportunity to practice working with each other, with other healthcare providers. And at the end, students actually debrief. They discuss what went well, what needs improvement, and this is all in a very safe environment.
All great experiences for our students before they enter the world of work.
Absolutely.
Sara, the simulations look very realistic. Can you tell us what it's like to participate in one?
Nerve-wracking, I have to say. When I think about simulations, I get very nervous and anxious because one of the reasons for that is the mannequins we have are very alive. They can blink, they can breathe, they can talk to you, they have anatomically right pulses that we feel. So when I'm in there, I don't feel like I'm in a simulation room. It's a real environment. So being in that environment is really intimidating. At the same time, the faculty actually provides us with a patient scenario beforehand. So when we get the simulation, we know who we have, we know a little bit about our patients, we have a little history. So we know what we're dealing with, and we can come up with an idea that what the care is going to be for that patient. And before we go into the room actually doing the actual hands-on care for the patient, we actually do a pre-simulation activity where we get together with all the students and the professor asks us about the lab values that we had, about the patient situation. So we talk about it, we come up with ideas, so when we get to the room actually, we are prepared to care for that patient. So we go in there, we do our care, and we try to do our best. And then once we are done, we go back to the simulation room where we do debriefing. So we talk about what we did, how we did it, what are the points that we need to improve. And it's basically about what we can do better next time. And the one important thing that we emphasize over and over again in the simulation room is actually the patient safety. That's number one thing that's a priority for us.
And the simulations allow you to make mistakes.
Definitely. That's a controlled, safe zone for us, that even though how hard we try, because we get very nervous, because we are being observed and we know that, we get nervous and we make mistakes, but that's okay to do.
Ceryl, interprofessional simulation puts students from different disciplines into one scenario. How does an interprofessional simulation work?
First of all, the faculty collaborate with each other. They look at the curriculum and they determine which programs will be involved in simulation together. From there, they develop objectives and create scenarios. And on the day of simulation, students from both disciplines participate. For instance, or for an example, is first semester nursing students work with physical therapy assistants, and they're in their first year as well. And both are learning transferring techniques with patients and the use of canes and walkers. So the nursing student will begin the scenario, bathing, feeding the patient, and then the physical therapy assistant student will come in, and it's a scheduled time for the patient to ambulate the patient and do some patient teaching with using either a cane or a walker. It's a win-win situation because students from two disciplines learn to communicate therapeutically with one another and learn how to work as a team. At the same time, practice communication with the patient, patient's family, significant others. So this helps them to learn how to communicate effectively together as interprofessional healthcare providers, and that has proven to provide safe patient care, communicating clearly what the patient needs and effectively carrying out those strategies for the patient.
Sara, what's next for you in your education? How do you see your simulation training preparing you for your career?
One thing that helped me with my simulation is that communicating with doctors with ASPAR. That's a communication tool, how nurses communicate about their patient's situation, where they call the doctor and tell the doctor about the situation and actually recommend a treatment plan. We don't do that in real clinical setting. What simulation provides us is that we over and over and over again, we practice ASPAR communication skills, where we look at a lab value. If it's abnormal, we call the doctor as a nurse and say, here's the situation, this is what my patient is going through, and this is what I recommend. So that's a great experience. If I can get out there and practice my ASPAR skills, that's because of the simulation experiences that I have here. So in every way that the simulation is preparing us for real life. So my plan is, once I'm done at HCC, I would love to go back to school right away without taking a break. So I'll be graduating in December. My plan is to look into the bachelor's degree programs, which I'm already researching, and start as soon as possible, get my bachelor's degree, and eventually get my master's degree and be a nurse practitioner once I have enough experience at the hospital that I work at.
Well, that's all the time we have for now. Thank you, Ceryl and Sara, for joining me today.
Thank you for having us.
Thank you for having us.